Hi everyone, it's Tammy from Transcend Rehab Wellness. I'm here to follow up on some information about dry needling. If you look back at my website, you will see that I posted about my experience in Chicago where I went to learn more about dry needling. Dry needling is a physical therapy service or intervention where we use an acupuncture needle to put into trigger points. Trigger points are the part of a muscle that where the peak contraction is within a few muscle fibers that are caught in a contracted state, which is called a taut band. The first thing you need to know is if we just pick one area that commonly gets trigger points, it would be like the upper traps here. If you have to carry heavy things and you're not used to doing that, you'll feel sore the next day in there, right? And if somebody pushes on those, if you go and get a massage and they work on those spots, they can actually kind of refer pain up your head, around to the front of the temples. And the importance of that is there's a lot of times that when, as physical therapists, we're working on soft tissue and we're trying Graston tools, which are, I like to call them expensive butter knives, but they're tools that help us save our hands over the life of our career. And they help break down trigger points, we hope. That's what we're hoping to do. Well, there's a nice new way where there's less tissue damage and it's a much more comfortable procedure, and we use an acupuncture needle. So I thought I would show you what that looks like in case you guys feel there's a need for it. Basically, this is an intervention that can be used when alongside of your traditional physical therapy services, or if you have something chronic and you've been working with it with a physical therapist and they can't get you any farther and they say, okay, let's just let you go home and work on this as a home program, and you're still having symptoms, that might be the right time for you to come see me and try dry needling. So let's take a look and see what it looks like to have it done, and then I'll give you some information about following up if you need me. First thing I'm gonna do is I'm gonna bring you into an exam room and just let you lay down on the table. I'm gonna put on a pair of gloves, and I'm going to pick a needle size that will be the proper size for the depth of tissue that I'm trying to reach. So I get my gloves on and I choose my needle. And meanwhile, you're laying on the bed and you're relaxed. You have pillows under your head and under your knees probably. And I'm going to find that tight muscle band that's causing or radiating a pain. Okay, so I found one on myself. I'm going to, on a person, I'm just going to give a quick tap and put that needle in. And I'll use my other hand to hold that tissue tight as I work to find that trigger point. And usually I've got my finger right on it, so I find it. And what we're trying to do with this technique is elicit a twitch reflex, a local twitch reflex. And that is when the muscle or the trigger point, when I hit it right on the spot of those tight fibers, it will send a quick reflex from the muscle that I just poked to the spinal cord and back again, and it'll cause a quick twitch of the muscles. That's what we're trying to aim for with this technique. And then once I've relieved that spot and it feels nice and soft like butter underneath there, I'm gonna go ahead and immediately put a little pressure on it to stop any little drop of blood, and then I'll move on and look for the other trigger points. So what you can expect from this kind of treatment is immediate pain relief. After you're done, you're gonna notice it feels different right away. I've had some very good success with hip pain and shoulder pain and headaches and knee pain. So patellofemoral dysfunction, or where the kneecap doesn't track properly on the knee. Those type of conditions sometimes are really chronic and hard to get better. And the muscles that are caught in those taut bands have not been able to be released because they're in big, thick muscles where a needle can reach it. So if you think you could benefit from dry needling or want to know more information, please call us at Transcend Rehab and Wellness. Our number here is 320-318-8812. Have a great day.